Welcome to this short video. I'm Ted Jedinak. You're about to discover super skill number 3 that maximizes your clinical outcomes for your MSK patients. Super skill number 3 that maximizes your clinical outcomes for your MSK patients is: when it comes to your patient's MSK conditions, the gentle skill of using joint mobilization is essential. This is the go-to treatment option that physios, osteopaths, chiropractors use when treating foot and leg conditions like heel pains, shin pains, calf and joint problems. Why aren't podiatrists taught mobilization therapies too? Whenever I point this out to physios and chiros that pods don't get taught manual therapies in our university training, the typical response is, really? Generally followed up with, well, what do you get taught then? Like, what else could be more important? To those MSK professionals, a manual therapy like joint mobilization is the obvious no-brainer option for assessing and treating MSK conditions of the lower limb. In fact, when I first started using foot mobilization therapies, FMT, back in 1994, it transformed my professional practice. I went from being a general podiatrist to an MSK specialist in just 12 months. And then a group of podiatrists in my hometown, whom we affectionately called the Fab Four, heard about what I was doing and asked me if I would train them in FMT. That's how I first got into teaching FMT. In fact, just last week I had a meeting with one of those Fab Four, Brenton. We're planning a new MSK CPD event in Australia with our Podiatry Association Managing Director. At that meeting, Brenton talked about the effect that first FMT workshop had on his professional path. A game changer was the term he used. If you're not using mobilization techniques to assess and or treat MSK conditions, I reckon it's like trying to work with one arm permanently tied behind your back. I mean, you've got the resources, you're just not putting them to the best use. You see, the essential tools you need for mobilization therapies are your hands, and you already have a pair. No need to invest in new expensive equipment that might end up being a fad. Geez, a shockwave therapy machine will put you back 20 grand at least. Hands-on therapies are the basis of physiotherapy, osteopathy and chiropractic and the remedial therapy professions. Your hands are also essential in terms of connecting with your patients. Heck, I've had patients tell me that the previous practitioner they saw for their heel pain didn't even touch them. Your hands are the most sensitive, dexterous tools in your toolkit. With your hands you can grasp, you can hold, you can move things. And your fingertips have one of the greatest concentrations of receptors, along with a big chunk of your brain that's dedicated to interpret their feedback for you. So why wouldn't you make the most of these amazing structures and upskill yourself to help more people like never before? Would it take work? Yes. Would it require some effort? Sure. Are your patients up for it? You bet. Just imagine confidently feeling joints and tissue qualities that would help you immensely in formulating your diagnosis. It'd be like untying your arm from behind your back and using it to its full potential. If you think you'd like to develop your manual therapy skills and see if it would be a good fit for you and your clinic, then click the link on this page. You'll discover everything you need to know to make an informed decision. You'll find the evidence base, the key elements that need to be mastered, plus how you can shortcut your path to FMT mastery through our FMT Level 1 training. If you've already completed FMT Level 1 and want to progress to the next level, click the link for the FMT Intensive, which is being run in Byron Bay for the first time since 2014. The FMT Intensive is advanced training in FMT Levels 2 and 3, and it's only open to graduates of FMT Level 1. The FMT Intensive will take your clinical and commercial results to the next level. Click the link and check it out. We still have some places available in our popular 2019 foot mobilization workshops in Australia. If you're interested in developing your foot mobilization skills for your MSK patients and saving with the early bird rates, simply click the link on this page to maximize clinical outcomes for your MSK patients. You'll get the full lowdown on what the training includes, what's new for 2019, and how to save a heap of cash. We already have FMT reviewers coming to the workshops, as well as clinic owners who are sending their pods along so they too can get even better clinical outcomes. As Benjamin Franklin said, an investment in your education pays the best interest. The next super skill, which is number 4 of 5, will be coming to you soon. Thanks for watching this video. It's truly great to work with practitioners who want to maximize their skills so they can help more patients like never before. Until next time, serve with spirit, consult with care, and mobilize more joints today.